Hello, my name is Dr. Stanley Lang. I want to welcome you to this broadcast. And the topic, as you can see today, is taking responsibility for your health. Now, the reason I'd like to talk to you about this is that I saw a patient today who is typical of many of the patients that I see, and probably typical of a lot of the folks that are watching this video. Somebody that's really wanting to be healthy is taking some responsibility, doing some things right, but really hasn't gone the full distance in terms of taking full responsibility for his health. And and this sort of came to a head because we were talking about a treatment that he was getting that was prescribed by a different doctor, a specialist that he was also seeing, and this treatment was costing him several $100s a month. It was coming out of his pocket. He couldn't really afford it. And we talked about how the relative value of this medicine was for him. Whilst the specialist technically was correct in recommending this treatment because statistically it did give him a little bit of an advantage in terms of avoidance of complications such as stroke or things like that. The relative benefit was actually quite small. And when the patient saw the actual statistics that I shared with him, he really was unhappy with himself that he had bought in this prescription, because if he'd have known that that was all he was going to benefit, that relatively small number difference, he wouldn't have invested that much money, because in his life that much money meant something much more important for him. And and at the same time, we talked about how he could also decrease his risk for those complications by multiple different things in his lifestyle that he wasn't doing. And these included, obviously, the usual things, the usual culprits: diet, exercise, the right nutrients in the diet, other lifestyle strategies that we've talked about before in terms of stress reduction. And he knew that he wasn't doing these things. Now, the point that I'm making is that, first of all, he didn't take responsibility for fully understanding the treatment that was being recommended to him, like asking the question, how much is this going to help me versus me not taking it? What are the actual statistics of me taking it versus not taking it? He hadn't asked that question, and he was kind of mad at himself that hadn't really done that after he actually heard the statistics of benefit versus not taking the medicine. Second of all, he was mad at himself because he really wasn't doing the things that could have really reduced his risk for this one complication that comes as kind of free. There's no medicine needed to reduce these risks if the lifestyle is embraced. And so, what I want to encourage you today is to fully embrace your responsibility for your health in terms of the lifestyle choices that you make. There are so many things that we can do that decrease our risk for disease if we'll simply take responsibility for them and do them on a daily basis. These are simple disciplines that, especially if you have a spiritual discipline in your life anyway, you can easily wrap it into your spiritual discipline and wrap it into your physical habits. And so this whole person health approach of health of body, mind, and spirit becomes a kind of a unified approach, that I'm doing these things so that I'm healthy in a whole person way. So I encourage you to embrace your health responsibilities, not blame it on somebody else, not farm it out to somebody to tell you what to do, but embrace the things that you know to do, that you know are already important for you to do, and reap the full benefit of what a healthy lifestyle can do for you. That means eating right, exercising right, the right nutrients that you might need to supplement. So I wish you well in this. God bless and have a great day.